Now I'm going to talk about labor dystocia, stall in labor, uterine dystocia. Essentially, the cervix has contracted, um, dilated in the face to a certain amount, and then there is seemingly no progress. Um, this can look like a mom who's contracting strong and regular, and things are getting progressively longer and closer together, and that stops altogether. This can look like the contractions seemingly not changing at all, but a vaginal exam would show that there's no cervical change after many hours. Um, there can be a variety of reasons why this may happen. The first, as a midwife, if I were the midwife in this situation, that I would look into would be her emotional state. Is she scared? Is she nervous? Is she tired? Um, Kind of where is she at emotionally? Um, After that, I would look to genuine fatigue. How long has she been laboring? How strong has this labor been? What has her nutrition and hydration looked like during this labor? Um, Trying to get kind of a full body assessment of where she's at physically and seeing if that may be a contributing factor. I would next kind of look at getting her to rest, whether as long as mom and baby seemed fine. And seeming fine could look like mom tells me that her baby is moving, and she knows in her heart that her baby is fine, and I feel the same way. Looking at baby could be using a Doppler and checking their heart tones, using a fetoscope and checking their heart tones for a few minutes and seeing kind of what their baseline is. Or not their baseline, but what their heart rate's looking like at that moment compared to their baseline. Checking on mom's blood pressure, maybe, if it felt right. Checking mom's pulse to see if it kind of agreed with being dehydrated or not. Really just kind of looking at mom and baby as a whole picture and seeing what is my intuition telling me, what is mom reporting to me, and do I feel like there are clinical tasks that should be evaluated in this moment. As long as mom and baby were doing fine, then I would probably, and labor seemed to be slowing down for whatever reason, I would tell her or suggest to her that she should lay down and rest, eat a good meal, drink lots of water, electrolytes, bone broth maybe if she's up for it, and take a good nap if she can, or even just laying down and resting in between contractions. Maybe giving her some alone time with her partner. Maybe she needs me there for actual support, emotional support during this rest time. But hopefully it would be her physically laying down and not using her body as much as possible outside of her uterus continuing to contract. And yeah, if this continued on, if labor seemed to really stall out, but maybe we were kind of already to that active labor stage, 5, 6, 7, looking at hormonal components, is it daytime and it's bright and her mom keeps coming in and talking to her and she can't get in the zone? Does she have actual hormonal difficulties, thyroid problems, endometriosis, PCOS, or something like that may be contributing to her hormones not working normally? Just talking to her, assessing the whole picture again and seeing what that looks like, if it felt right and mom agreed that we needed to actually do something. Maybe her water's been broken for a long time. I don't know. The midwife I work with will usually suggest castor oil or tinctures during this time. I don't necessarily agree with using castor oil to speed things along. I don't think things need sped along. But maybe talking with the mom and saying, what does she want ultimately? As long as it's safe, I will follow what she wants. So if she does think that she needs things sped along, then maybe I would use tinctures. There's, what is the tincture name? Oh goodness, it slipped off my mind at this exact moment in the middle of the video. But I know that there are a couple of tinctures that can be used to kind of help improve uterine contractions, kind of bring them on and keep them going hard and strong if that's what's needed. The midwife I work with seems to think that's needed most of the time in these kind of stalls or wonky labors. I don't know that I agree with that, but I probably will carry them, at least in my car, as a just in case. But a lot of times I think that as long as mom and baby are okay, it's okay to let them rest. It's okay for labor to completely fizzle out, even if they are further along, as long as everyone is physically okay. So yeah, that is kind of a variation of normal. Labor can stall for hours and nothing happened, and then all of a sudden things pick back up and mom has her baby quickly, or not, but labor continues on normally. But a stall in labor is not the medical emergency that hospitals and doctors would have us believe. A stall in labor could just be the body needing rest, the mom's mental state, or something mild and unconcerning.